Okay, we're live.
Hello, everyone. Welcome to another Fresh Dental Shadowing session. Today we have dental dentist Dr. Lisa Cho, and she will be sharing her dental journey with us. So, Dr. Cho, whenever you're ready, you may begin presenting.
Thank you. Nice to meet everyone virtually. My name is Lisa, and I'm a general dentist working in Canada. So here's a bit of my background. I wrote my DAT back in 2009. I graduated from my bachelor's in 2010, did my 4 years of dental school right after, and then worked in private practice since then. In my undergrad, I was in biochem until third year, and I realized I don't like biochem. I'm not getting great grades. This is not the smartest decision. So even though I only had 5 more courses to complete to get my degree, I decided, okay, since I'm not going to pursue my career in biochem, it's better to find something else that I want to take. So I did general science in 4th year. In that year, I just took whatever I wanted to feel like. I took random courses from theater to international music to poetry, pretty much all the courses I couldn't take in my 3 years of biochem. I currently work in Surrey, full-time practitioner. And these are my topics of discussion today. First one is why dentistry. So some people ask me, why did I choose to go into dentistry? So I can talk a little bit about that. I always liked doing things with my hands, fixing things with my hands. And dentistry to me was an area in healthcare where I could combine both art and science. And in undergrad, a lot of my friends actually were wanting to get into medicine. But to me, given my background, I figured, okay, maybe I'll try for dentistry. That seems to have everything that I'm liking, the artsy part of it, science part of it, and being able to work with my hands. Back in the day for the DAT in Canada, we did have a section called soap carving section. This is how I date myself, but this is no longer required for UBC dentistry. But at the time, this was one of the sections that I did really well on. So I figured, okay, maybe I have a bit of a skill in like doing things with my hands. Maybe I should consider applying, and I chose to apply to UBC dentistry, which is the dental school in the province that I'm in. So UBC dentistry has undergone a lot of changes in its curriculum in the last 10 years or so. But when I was in school, the first 2 years were spent learning medicine and dentistry. So we actually took full curriculum, same curriculum as med students. And our clinical didn't start until third year, which compared to American schools, I know that's considered quite late, but that's how it was back when I was in school. We did start dentures in second half of second year, but pretty much full-on clinical started in third year. A lot of my colleagues took internships and did residencies that were available for undergrad students between third and fourth year, but I actually worked. We had a program called Summer Student Practitioner Program where you can work anywhere between, I believe, 3 to 6 weeks once you have a clinic that will sponsor you as a student. So I wanted to see what rural dentistry is like. So I went and practiced in a smaller town, and I did about 4 weeks of private practice under supervision. In school, I was very much an average student. I liked root canal, endo the least, and pros the most. So I thought to myself, okay, if I were to ever specialize, maybe pros, perhaps, but I wasn't really interested in specializing at that time. Didn't really think there was any specialty that I had strong affinity to, so I went straight into private practice. So this is where I am currently with my schedule, and I have it set up so that I can be as efficient as possible with the way I work. So I work Monday to Thursday, which is technically considered full-time. Mondays and Tuesdays, I primarily do fillings. So I don't schedule filling appointments Wednesdays and Thursdays so that I can focus more on heavier, more involved appointments. And Thursdays are usually for surgeries and endos. And these are the things that I like the most currently, which compared to when I was graduating, changed completely, like 180 degrees. The things that I do, I listed up here pretty much everything except the things that I don't want to do. Of course, I don't know how to do everything, but I do enjoy learning different things. So in the last 8 to 9 years of practice, these are the CE courses that I took, and I'm gaining more experience providing different kinds of treatment, soft tissue grafting being one of the newest procedures that I'm doing. So specialty and general dentistry, I know a lot of people have questions on whether they should specialize or not once they get into dental school. And a lot of my classmates actually, they knew that they wanted to specialize in their third year. They prepared for it, wrote the boards, and went straight into residency after graduation. This is from my point of view, who's been working as a general dentist for about 8 years. Pros, you do get to do lots of things. Like I mentioned in the things that I provide, one appointment to another, I get to do different things. And if you're the kind of person who find this kind of schedule stressful, then general dentistry isn't really ideal. But I like it. I like doing, root canal to surgery to peds to fillings, whichever that may come in. I can always refer out cases that I don't want to do. As a specialist, you don't have that option. You're the one who has to deal with everything. Another big thing for general dentistry is that I can build relationship with patients as their primary care provider. So as a specialist, people don't come to see you over and over again. And that's the hope, that they don't need to come back and see you over and over again with the same problem. But as a general dentist, you become their family dentist, like family doctor, and you can build a relationship that way. And I like that part of dentistry. And there's always something to learn. So going back to the list of things that I do, I didn't know how to do this right from the beginning. I didn't start implant dentistry until 5 years after graduation. Different things like soft tissue grafting, maybe 7 years out. So there was always something to learn. Downside, if you will, of general dentistry, it is not focused. You're trying to do all these things and you can't be really good at one area if you're dabbling into different areas. So you are going to be at most good at everything, but not excellent in everything. Another aspect is because there are different areas that you need to do within dentistry, it is more difficult to come up with like a comprehensive treatment plan where you do fully understand one aspect of dentistry to another so that you can provide that care to the patient. Mostly patients don't want to be referred out to like 7-8 different people for whatever that they need. In an ideal world, they want you to be able to do everything for them, but it's impossible oftentimes to be that one person who can fix all of their problems. But with more CE and more learning, you're hoping that you don't have to refer out as often as you used to back in the day when you first graduated. And depending on how you look at it, there's always something to learn. So this can seem a little bit daunting because no matter what you do, you seem like you're never good enough and there's more to do. And especially on Instagram, where people post a lot of their best and the greatest, and sometimes you can get lost in that. And it's difficult to not compare yourself to others, but that can be the downside, that there's always something to learn. Whereas in specialty, for example, in endo, you go in and you do your residency 2 to 3 years, depending on which school you go. You practice, let's say, 10 years of endo. you're going to be pretty proficient at it, and there isn't going to be anything dramatic that you need to learn 10 years out. It's going to be pretty repetitive, which can be, again, depending on your personality and who you are and what you like, good or bad. So these are some of my recommendations based on the fact that I did general dentistry and didn't specialize. If your reason of wanting to pursue dentistry is because you don't want to work in a hospital setting, for example, and that was my reasoning, this is a very limited view of medicine, and I think people should explore all different kinds of options within medicine. Same with dentistry. Not all dentists need to care for patients. Some dentists, specialists, people who work in labs, they don't need to interact with patients. And if you are like that, then there's a pathway for you in that way. One thing I do recommend is not going into specialty right after school. So whether that be a year after school or 10 years after school, like some of people I know, I think doing private practice will allow you to test and try different areas of dentistry, and it may change your mind. Like I said, when I first graduated, endo was my least favorite, but it is my favorite procedure to do now. So once you choose specialty right out of school and you decide to become a specialist in that field, if you end up not liking it all that much, well, you just spend 2 to 3 years post-grad, a lot of money to get that degree. So you have to stick with it. But in private practice, you get to do whatever and then see if you want to specialize or if you want to stay as a GP. If you choose to remain a general dentist like me, I do recommend taking lots of CEs in the first 5 years of graduation. In this 5 year, I tell people is where you get to experiment and try different things. Do all that you can, that you feel comfortable. This is where you'll find out what you like and what you don't. And once you have enough experience, you get to say, this is not something I want to do. I know some people exclusively don't do endodontics because it's something they don't like. Some people cater more to peds because they realize they love working with kids. You get to learn real dentistry, real world dentistry, and you get to know a little bit about who you are as a practitioner. And to learn a lot from people around you and not see Instagram and these kind of social media platform as an area or a source of competition, but rather a place where you can connect with people and learn from each other, because that's what's going to make it all better, to have people that are on the similar journey as you, so that it doesn't feel as lonely, because it can be like that sometimes, especially if once you're done graduating and in private practice doing dentistry alone in your clinic. That's all I have. This is my Instagram. I hope if it was helpful, a bit of an insight into what my life is like as a GP. If there's any questions, I'm available.
Thank you so much. So now we will move on to the Q&A session. So I have a question that is, what is one thing you wished you knew before going into the dental field?
A very good question. You will have to do a lot of HR, way more than you ever expected. So HR, human resources, dealing with people, whether that be staff, whether that be patients, reps, whoever, just people. Like in dental school, they teach you how to drill, but that's about it. But in private practice, I stress about the actual procedure maybe 30% of the times, and 70% is like managing people. Okay, like this person in the chair or my team. There's always something that come up, especially if you work in a bigger clinic. Few people I know have decided dentistry isn't for them because of this factor, because it's so HR heavy. And if you know that you're this type of person who likes to work alone in the quiet environment, at your own pace, this is like complete opposite of working as a general dentist. So I wish I knew more about this. And I wish dental school would go over HR and business management more than they do, because they hardly don't. But yeah, that's one thing I wish I knew more about so that I could have been better prepared.
Yeah, that was going to be one of my other questions. If dental school prepare for the business aspect, or you just had to learn it on the way? So on the way was.
They don't, honestly. Being like working as a dentist and running a business, it is two different things. But to have a clinic, if you're going to be a clinic owner, you have to do both. There are only very small percentage of people, very, very, very small percentage of people who are naturally good at both. A lot of people are good at clinical dentistry, but not great in running a business because they've never done it. Makes sense. I'm sort of in that category. I love general dentistry and I love what I do, but I don't know much about running a business. Because running a business is same whether it be a clinic or a nail salon or I don't know, like an online shopping platform. The concept is similar. So and some people unfortunately are very good at running a business, for example, but aren't the greatest dentists. And sometimes patients, they don't really know whether their dentist is doing ethical work or not. Like they may see outside of that clinic the way they advertise and believe that they're great, but you never know. Only fellow dentists would be able to judge whether someone's work is ethical. Like there's a whole issue with this. And that's why I believe there are different models like those corporate businesses where a company owns a clinic and they hire people who can do the dentistry but may not want the headache of running a business. Some people, again, are happy to do that. Other people, they want a little bit more control in how their schedules are run. Some people are comfortable in doing everything, but only after they've worked for several years to gain that clinical knowledge. So there's tons of different kind of pathways that you can take once you graduate. And I think this is one of the things that can be difficult because up until graduation, everyone's going on the same path. You're all in a crowd. Once you graduate, some people go into specialty, some people go to private practice, some people end up staying as an associate for the rest of their lives. Other people become an owner right after school. And so you may not have someone who you can kind of learn with. And maybe that's why there's a lot of dentist couples where they do clinics together because, it's more easy to work with a family member in a sense than like a complete stranger or partner or by yourself. So I see that commonly too.
And you mentioned corporate dentistry. Did you ever consider corporate or did you always knew you wanted to do private practice?
So back when I was in school, the corporate dentistry didn't have a great rep. I don't know if they still have that now because it was so long ago, but I had this idea where, yes, if you work in a corporate clinic, all they care about is production, bottom line. You have to just do certain things to meet the bottom line. And I've heard these stories, and this is a very broad generalization. I know I have colleagues that are part of the corporate dentistry clinics that are not like this. So long story short, back in the day, no, I didn't want to because of these biases that I held. And I wanted to be able to do dentistry the way I wanted to. Like everyone has a different view on what's ethical or not, but I never got into dentistry for money, and I didn't want that to be the determining factor. So that's why I went to rural dentistry. There, I don't have to worry about people wanting dentistry for aesthetics only that I wouldn't feel comfortable doing. It's bread and butter dentistry that I get to do, fixing cavities and taking out wisdom teeth and all that kind of stuff. Looking back now knowing what I know, I think as long as you do your research and get to know the company and maybe if possible shadow the clinic, I see no reason to just rule out corporate dentistry from the beginning. Even private practice dentists can be not ethical. Like they can do whatever they want. It's just because it's a private practice doesn't mean everything's going to be great too. You can work as an associate and the principal may ask you to do things that you don't feel comfortable. So yeah, it's a matter of finding a clinic that you align with, and it's okay to go through multiple clinics when you graduate. You're not a failure if you give notice or you switch clinics, because you can feel that way like I did. And that's why when I first gave notice to my second job, like the first job was contracted, it was 2 years. I left because the term ended and that was all simple. But the second one, I decided to leave. I felt really bad. Like, should I have made it work and whatnot? But no, like it's kind of like dating. You find the person that you jive with. And if it's not working out, it may not be because they're wrong and you're right. It's simply possibly that you guys just don't work well together. It could be communication style, it could be personality types, it could be different stages of life, multiple reasons.
Yeah, everyone's different and everyone chooses their own path.
Exactly.
So you had mentioned also shadowing briefly. Do you have any tips for pre-dental students that want to get into shadowing, any tips for them to get the best experience possible?
So I shadowed before I got into dental school, and I didn't shadow as in like I stood in the room and just stood there for them to do the procedure and watch, but I actually volunteered to work as a steri assistant. So some clinics, especially busy ones, will appreciate having a sterilization assistant if they don't have one already. And you as a steri person will help turn over rooms, put away instruments, things like that. And it's not like you're busy all the time because you're only busy in between procedures. So once you're done your part, this is what I did. I went into the ops and watched what they were doing, and just being in the environment, listening to them talk, there's tons of things to learn. So that's the route I took. I made myself useful to them so that they wanted me there. I'm not a burden when I'm shadowing. I have a patient who's a grade 11 student. He was and is a student and is wanting to become a dentist. He asked me if he can shadow, and we already have that relationship. So I said, yeah, why not? So he actually comes about once a month on a Tuesday evening and shadows. And he makes himself available. If we ask him to do something, he's like ready to help. And I was initially worried that, because we're so busy working, we might not be able to care for him as a shadowing student when he's in the op, but he kind of became part of the team now. So it's like when he isn't there because he's away or something, we're like, we miss having him. I think, that's another great tip. If you already have a dentist you go to and you have that relationship, ask. That's the easiest way. And I'm assuming you're a patient at the clinic because you like them. So
that's great. It's great to get involved early on. So I had another question. If you did any mission trips during undergrad or dental school, and if so, how was the experience? If not, it's okay. Not everyone does mission trips.
So I didn't do any mission trips or residencies or anything. The only thing that I did between my third and fourth year was that work experience that I did for about 5 weeks. I just wanted to see what real life dentistry is like, and I knew school wasn't that, so I wanted to start working as soon as possible. So that's what I did.
great. And what factors made you choose UBC over other dental schools?
I live here, so that's the only dental school I applied. In Canada, if you apply to the province that you live in, then that's easier than applying to a different province. And that's designed that way so that they encourage people who live in the province to continue living in the province rather than needing to move. UBC is the most expensive. I'm not sure if it's still now, but back then it was the most expensive dental school. We didn't get many students applying from other provinces to come to the most expensive school when you have the opportunity to go to a cheaper school in their own province. I mean, I know a lot of people took that as an opportunity to apply to schools in different provinces, especially in the States. Like, you don't have this kind of restriction or a favor system. And they saw this as an opportunity to live in a different province, or not a province, a state. And I think that would have been fun too, like living in a dorm, because I didn't get to do that because I live here already. So I missed out on that. So there's pros and cons of both options. Like, because I already live here, I got to save money on living expenses. But I did miss out on living in a new city, living in a dorm, things like that. But yeah, I applied to UBC for that reason. I live here already.
Yeah, price and location are definitely important factors. So what is something you wish you knew before going into dental school? Like, how is the transition from undergrad to the dental school?
So I think the transition from high school to undergrad is similar from undergrad to dental school, in a way where you might be used to receiving certain grades in high school, but then you go into undergrad and you're like, oh, it's a different playing field. Same with undergrad. You're used to having certain kind of GPA or grades, people that are similar in terms of your academic strength. But dental school is like best of the best in a small group of people. And I meant it when I said I was like very much average student in my class. We had some amazing, brilliant people in our class that went on to do specialty and other things. But even though, at times you may feel like discouraged with the fact that there are all these smart people that are better than you, like, different people have different strengths, and is to not get lost in the shortcomings or your weaknesses, but the other aspect of it, which is your strength. Because everyone can be not good at certain things, but they can also be good at other things. So it's a matter of finding out what you're good at. And that's why I decided to leave biochem. I was not good at biochem. I did it terrible. My grades were bad. If I continued with biochem, there was no way that I would have gone into dental school with that grade. So just figuring out, what are you looking for? If you know that you're going to not go into biochem career, leaving that major is not hard. But if you're undecided, then it can be difficult. So figuring that out early on, what you like and what you don't, and what your end goal is.
And also related to dental school, what was your favorite and maybe least favorite class from dental school?
So there's lots of least favorite classes. Few favorites. It really depends on who the instructor is, unfortunately, not really the actual discipline that you're learning. So this is very biased to the people that I had, and I don't think it's really relevant. I liked clinical dentistry in general. I didn't really like the research and all the reading that we had to do. And some people like the academic side of things and they want to pursue more in that, which is great. That's where you become a specialist and perhaps go into, your master's program, and anything thereafter, you can become a prof and things like that. Whereas I, like I said, wanted to do general dentistry work as soon as possible. I didn't like endo, like I mentioned, but turns out I do. And this is only something I found out by working. So in school, I wouldn't put too much emphasis on what I like and what I don't like. I think the only way you will get to find out whether you are suited to do specialty, and if so, which type, it would be to go into private practice and work for a year. And this is not a detour at all. Like, a lot of specialty schools will look at experience as a huge plus, not a minus, because it shows to them that you are serious about the specialty that you're applying. It wasn't just something you chose while you're in fourth year because that's what everyone else is doing. You, after working, let's say a year to two or whatever, that you realize this is your passion and you want to go into it. And I have a lot of people in my life that are specialists that have gone into specialty many years after graduating from their dental school. Our endo department head, he worked as a general dentist, I believe, like 9 years. And then he went into endo school. And then now, well, at the time when I was in school, he's head of the department. So there's no right path. There's no one path. You may have family plans. You may have other things going on that may not put you in the path that you were on, which is like go from one thing to another right after another. And that's okay. That's totally fine. You just take your time to figure out what you like, because this is not a decision that should be made lightly. It's going to define what you do for the rest of your life. So take that 1 to 2 year time, or 10 if that's what you need.
So I was also wondering if you had any tips and advice for the dental school interview process.
Oh, so this is another aspect where it is very much school dependent, and the interview process that I went through, even for UBC, for example, is not the same anymore. They revamped the whole thing. The last I heard, they're doing more like an MMI style, which is what the medical school is doing. I don't know too much about that. We did PBL style, problem-based learning style interview process, where it was a small group of people. They would present us a clinical scenario, and they would kind of watch us talk about this problem and then see like how we interact and all that kind of stuff. But honestly, the only thing that I would say is important is for you to be genuine. These people, they're used to interviewing people, and they've gone through a lot of interviewees. And if you come in there and you're not really in it, like you're just kind of there because you just don't know what else to do, or your whole family's in dentistry and you feel like you need to, and clearly there's no passion, people can see right through you. So if you're genuinely excited and you're genuinely wanting to be in this profession to help people, because that's what it is at the end of the day, you're there to help people, it's not about you, then I think that shines through and people recognize that. Being a people person helps, but you don't have to be the most extroverted person in the room. You can be quieter, but as long as you, I'm not sure if your school has the group interview process, but if there is, then being able to work with different types of personalities, like you're able to be flexible, that's another big thing, because you're going to see lots of different types of patients. You're not only going to see patients that are similar to you. So if you're inflexible and you can only jive with people that are like you, well, then you're going to run out of patients to see. So that's another aspect. Are you flexible? Are you people person? And the rest of it, honestly, I'd say it's just GPA and your test result, which it's fair and not fair, because how can you really determine who you are as a person and whether you're apt to become a dentist or not based on one entrance test? But I mean, they need to have some sort of standardized testing system to evaluate a large group of people.
You mentioned the different types of patients, so I wanted to ask also, how do you deal with the more anxious patients?
That's a great question. So as a general dentist, I do see variety of people. Usually it's a bell curve like this. So in the middle, you get patients that are, they don't like to be there like most people, but they can sit there and get the work done and go on their way, no problem. On the other side of the bell curve, they're very anxious. Getting cleaning done is stressful. Just like seeing dental clinic signs stresses them out. And the other side of the bell curve, they're so relaxed. They've been in and out of dental clinics since they were little. Honestly, they're less scared of needles than you are, that kind of patient. So for those really, really anxious patients, the only way is sedation. No matter how sweet you are and how catering you are and all that good stuff, some people either had too traumatic of an experience and that cannot be erased no matter what you do. That's the most common reason. I don't really have another example, but yes. So those patients, you just offer sedation. I personally don't offer IV sedation, but there are general dental clinics where they provide all kinds of procedures with IV sedation, and patients love it. They just pay a fee, they sleep, work is done, and they're happy. For vast majority of people, so people excluding at the tail end, but bell curve and the people that are not anxious, option is to provide them with oral sedation. And really, if they like you, then they'll become less anxious. As to how to make them like you, I mean, you can't be liked by everyone, that's one thing. So being able to know that and understand that, and if the trust isn't there, then you can always refer a patient. At the end of the day, like I said, it's about caring for patients, and as long as they're cared for in the way that they need, then it doesn't really matter if it's you or another person. I take the time to get to know them and get to know why they're anxious, and oftentimes they have a story to tell, and once I listen to them and they feel like I care in a genuine way, then I find that they open up a little bit more, and that helps with their anxiety. I had some patients, like I mentioned, who required sedation for their cleaning appointments and things like that, but a lot of them, quote unquote, graduate, meaning they needed oral sedation in the beginning, but then once they see you multiple times and they're used to the staff and everyone else, they eventually feel less and less anxious, and then they wean themselves off of oral sedation. Not everyone do, but people are a creature of habit, and they get used to things, and the anxiety level does decrease if you're exposed to the same environment over and over again. And so on that note, I try to have the same assistant assisting me for these types of patients, so that it's not just me that they're seeing over and over again, but it's the assistant who plays about 50% of the role in getting the procedure done. Same person, so that they can also feel like they have a connection with them too.
That's nice. I had not thought of the consistency of keeping the same assistant. So another question is, you had mentioned that you chose dentistry because you like doing activities with your hands and you like the art part of the field. So what are some activities that you did before dental school to sort of prepare yourself for the hands-on activities?
I didn't. As a kid, I liked playing with Legos, and I always liked taking things apart and putting things back together. If our fireplace was broken, I was with the person who was fixing it, trying to see what he was doing, like that kind of thing. Not anything directly academically geared and getting myself ready. I liked puzzles. That's also hands-on. Anything hands-on, like origami, fixing things. Lego was a big one. I did really like soap carving though. When that was a thing, I bought so many soaps, and I don't know if it directly relates to what I do now, looking back, because if for those few people who don't know what soap carving is, and I feel like most people don't because they don't look at that anymore, it's a cylinder of soap where they give you a diagram, and obviously that diagram is on a piece of paper, so that's 2D, and they want you to use a knife to carve something that they're showing in 2D and 3D. And it's not anything elaborate. They're not asking you to carve out a rose or anything like that, but they're asking like angle is 90 here. It's a 45-degree angle here. This is 6 millimeters. This is 2, et cetera, et cetera. And the more accurate you are, the higher score you get. And this is everything else I did okay in, like I was average, I'd say. But in this section, like I mentioned earlier, I was top 1% in Canada in that cycle that I wrote it. And partly because I just really enjoyed doing it. So I did it over and over again. It was like a pastime thing. I would watch TV and I would soap carve. And I think it goes to show you are going to get better at the things you like. I certainly didn't study OChem the way I did soap carving. I didn't study it over and over again because I loved it. So same with specialty. Choose something you like to do and you'll get better quicker.
Like career choice, it's important to choose something you like.
Mm-hmm. So first question is, do you like dentistry? That's one question. And then once that's a yes, you go into dental school and then you think about, okay, do I want to specialize? Do I not?
Yeah, it's different for everyone. So you had also mentioned the SSPP program, which was when you went to do rural dentistry. So how was that experience like more, and did you learn, like what lessons did it teach you?
So the SSPP program doesn't have to be rural. It can be any dental private clinic that has a principal dentist that's willing to take on a student. I just chose to go rural because that's what I thought would allow me to learn the quickest. Like I mentioned, our school didn't start clinical until third year, and I felt like this is not enough time to learn dentistry compared to other schools. So I felt behind already in school. And that's why I felt like I needed to get more hands-on dentistry sooner rather than later. I did lots of fillings. I didn't do anything exotic. I don't remember if I did surgery at all, like wisdom teeth removal. I may have done simple crown, a few of them, single unit, but I'd say vast majority, like 90%, was just large, difficult fillings to do. The clinic that I worked at had a lot of people who couldn't afford a regular crown, and so I needed to do a lot of fillings, and it allowed me to be proficient at it, be efficient at it. I actually like filling procedures the least right now, so there's that. But yeah, I just got to do a lot of like the most basic part of dentistry, which is fillings. Now, yes, prepping a class 2, prepping a class 1, drilling the tooth is basic, but filling those teeth, not basic. Maybe you guys heard of the term biomimetic dentistry. Once you start getting into this, it's a filling where, for example, a simple filling on a molar can take like an hour and a half because they're creating all these grooves and they're mimicking nature. And I don't do that because I haven't learned that system and I don't have the skill sets to do so at the moment. But there are amazing dentists out there who do amazing restorative work, and doing that is by no means bread and butter simple. Fillings have this reputation of being basic and boring and whatnot, but this area, it's like artistry. It's like each Chanel bag is made one at a time. It's like each occlusal filling with the occlusal anatomy is done one at a time. If you have the hand skills and you like spending time doing this, creating one unique piece of a composite restoration, then that's an area you can get into too. But yeah, how to do fillings. That's what I learned in that 5 weeks.
And it must have been nice to get more hands-on experience before you actually went to the workforce. It's
like the whole year you just had rainy weather and you're just looking forward to that sunshine, and bam, like Vancouver summer comes in 2 months, you're just enjoying that. It's kind of like that, where while in school, not many patients we get, and we don't get to have a lot of procedures that we get to do. So when I was in that private practice for 5 weeks, I loved seeing real patients that needed real work. And yeah, that time went by really quickly. A lot of people did residency, which I know they enjoyed too. So I don't know much about that because I didn't do it and I didn't look into it. But like New York, I know is one of those schools where they provide that kind of residency programs for third-year students, I believe, if they still do.
And when you transitioned from dental school to the workforce in a private practice, how was it getting patients? Because it might be hard starting off like at the beginning.
Mm-hmm. So depending on where you are will determine that. And if you are in the city versus outside, rural area, that's going to also make a difference. So I went back to the city that I did my practicum between third and fourth year because I still wanted to learn more about rural dentistry. Like that, the city wasn't that small. They wouldn't consider themselves rural, but compared to Vancouver, it's rural. So in my mind, it was rural dentistry. I didn't have shortage of patients. The clinic was already very busy. They were waiting to get an appointment booked with the principal dentist, and they would need to wait months. So I came along and they were given an option. Like you can wait 3 months to see the principal dentist, or you can see this new person, and the wait is like 2 days. And that's one of the reasons why I went up there, because I wanted to be busy from day one. And I didn't want to do any hygiene. Some of my colleagues who stayed in Lower Mainland in a bigger city, that's something inevitably you have to do to keep yourself busy, because it's not possible to have a fully booked column from day one. As to how long it takes for your schedule to get booked and ramp up to a point where you have a fully booked schedule on a consistent basis, it really depends. There are some times where you're not fully booked, like the second clinic that I left, even after months of working, and you decide, okay, well, maybe this isn't for me. Other times you're super busy, but you may not be doing the procedures that you like doing. Again, something to also to consider. You may be fully booked, but you can't get along with the assistant, or you love the assistant, but there's no work. Like there's a whole bunch of different combinations that can exist. And if you're solely prioritizing wanting to be busy from the get-go, then go rural. Yeah. Less competition, more busy.
So another question is, you had mentioned also in your PowerPoint that you recommend taking a lot of CEs coming out of like into dentistry. So what are some things that you found interesting and learned from those continued education courses?
What are some of the things that I found interesting by taking those CEs?
Yes.
That there's always something to learn. There will never be not enough CEs, and certain CEs may seem like it's a lot of money and it's a waste of time or whichever, but myself included, it's amazing how much you pay attention after you graduate from dental school when you have to pay for your own course. Like if I did this back in dental school, I would have learned so much more. But now it's like I'm willing to fly 5 hours to go to a different city to take a CE, and it's an opportunity to meet people. And when you're there, you feel like you're still part of something, like you were back in school, and it gives you purpose, and you don't feel like you're the only one struggling to learn, because like I mentioned, there's always something to learn. And a lot of dentists are perfectionists, and we always strive for that, and it can be daunting at times, like I mentioned. But yeah, the CE courses, conferences, it allows you to kind of see the bigger picture and realize, hey, like, I'm just this one person learning. I don't have to feel like I carry all the load on my shoulder. I'm not alone. There are lots of people, even people with lots of experience, they still say there is more to learn. It's only people that are recent grads that they know everything. So, and we all go through that where you think you know a lot when you first graduate, but really you know nothing. And then your confidence drops a few years after. You're like, oh my God, I don't know anything. But that's like when you're starting to really learn. And then over time, you're like, you know what? I'm not perfect. There's a lot to learn, but I am getting better. I'm gaining more experience. So everyone goes through that. Like, this is not unique to one certain person. So, and I highly encourage taking CEs that interest you. One advice that I got from my principal when I first graduated is he told me not to feel pressure to take these big name CE courses. One of them being COIS, for example. It's a very expensive continuing ed course, very world-renowned, highly regarded, but you don't have to feel the need to take it second year out. A lot of that information will go over your head. So take it when you're ready. Don't take it because other people are taking it. Take it because you want to. Then you'll actually retain the information that you get.
And did you have a favorite topic that you learned from those CE courses?
The one that changed my course of career is the endo CE that I took a couple years out. I started doing more endo in the first 2 years, and I realized, hey, this is something I want to do more. I took a course. It wasn't anything profound. They pretty much reviewed what we were taught in school, but I guess at the time I was just so ready to absorb the information. And there was a patient component where I got to bring my own patient, and we did endo on that patient. And for some reason, that was a very difficult endo, and I learned a lot. Seeing the specialists also struggle to do that endo, I was like, oh, okay, even specialists have a hard time with this kind of a tooth. That was sort of the beginning of taking CEs for the things that I wanted to learn. The most recent one I took was perio, and I did a few gum graft cases, and I thought this is the last thing I'll do because I hated dealing with gum tissues. That's why I didn't really like surgery, because you need to cut gum tissues to remove wisdom teeth. But it's amazing how things change. So never say never. Like, honestly, I look at myself back like 6 years ago, and I don't even know that person anymore. It's like two different clinicians, two different practitioners. And that is truly the beauty of being a general dentist. And of course, who knows, like next year I might go into specialty. Like, I don't know, like we don't really know what's going to happen, but yeah, I see this as the greatest strength, that you have the option to take whatever CE you want to take, and no one's to say no. And honestly, if you feel comfortable, then you get to provide all these procedures to different patients, and patients love it if they don't need to go see someone else. If you can do Invisalign for them, if you can do gum grafting, you remove their wisdom teeth, and you can do their fillings, and they're like, oh my gosh, I don't have to see anyone else, they'll love you. So being that super GP is what a lot of us are actually striving for as GPs.
Like you mentioned, people change and the dental field changes as well.
For sure.
So another question I had is that you had mentioned learning from those around you. So how important is mentorship to you? And do you have any tips for how to find a mentor in the dental field?
I think it's huge. Not the most important, because at the end of the day, they're not there as your teacher. They're there to do their own dentistry. So it's not realistic for you to be able to, or wanting to learn a lot from your principal dentist when you're working as an associate. Like, they have their fully booked schedule. They won't be able to come over and then help you with every single case. But having someone that you like, that you can look up to, that sets the tone, in my opinion, because I really liked and still like the principal dentist that I worked with when I first graduated. And he was the one, and his clinic was where I got to learn the real endo, and I fell in love with that. If I worked in a different clinic, who knows? Like, I might have liked something else. I don't know. Having someone who believes in you, who can be the person where you can ask any kind of question. No question is silly, and sometimes it's just knowing, getting that reassurance that, yeah, you're not the only person who thought of this. Like, a lot of people before you have thought of these same issues, have worried about the same concerns. It's knowing that you have people to help you grow, because if you grow in the clinic, they will grow too, because they benefit from you growing. You can find your mentorship in CE. Those people at the screen or up on the podium, they're there to share their knowledge. And yes, you may not have those one-on-one personal contact and personal relationship that's like mentorship, but it's still in a way like that, where you get to be in that room and you wouldn't have known their personal tidbits had you not gone to the CE course. So yeah, it doesn't have to be like a lifelong thing, like my principal dentist and I that I've known for years now. It can be all the instructors that you meet through CEs. And also anyone who's got more experience than you, they all can be mentors. But on the same token, people who have less experience than you can also teach you something. For example, I a few years back started working with a new grad, and at that point I've been practicing for about 6 years, so it's been some time, and you're about to forget the times that you're in school. So working with that person has allowed me to see, oh yeah, like you can have that kind of point of view. I wouldn't have thought of that. Or questions that they come up with, like, oh, I didn't think of it that way. If they ask you for help or ask you for questions, you have to be able to explain things in a way that they'll be able to understand. And that's something that requires work too, based on different personalities and things. So mentors, I believe, can also be someone with less experience than you, as long as you're willing to learn, have that open mind.
So you would say mentorship is beneficial both ways?
Absolutely. Yeah. You don't know what you don't know, so they can show you the way.
So I have one more question, and it's kind of creative, but if there's something you could change from the dental field, what would it be?
Oh, this is an easy one, because I already had one in mind all these times. Google reviews. Bane of my existence. So it's great if they love you and write you this essay of why they love you from XYZ and all that stuff. But if they hate you, they can also do the same thing. Now, oftentimes it's not based on anything, but internet doesn't care whether it's true or not. These people can just share whatever they want. And I don't think this is pertaining to dentistry only. This Google review system has taken over, where people feel entitled to share their opinion on things that are just not relevant or not true. Like during COVID, I know a lot of people have left 1 out of 5-star review because they had to wait outside, like they weren't allowed to be in the business, for example. But like, this is COVID, like these are regulations, but they can still share that information, and that affects your business. So like I said, it's great when it's great, but it's not great when it's not. Unfortunately, we have to work with it because it's not going anywhere. People look up their Google reviews to figure out where they're going to go eat and what kind of dessert they're going to get. Same with dentists, who they're going to see, and whether they're good or not, they have no idea. But if the reviews are good, they must be good.
That's interesting. I hadn't thought about Google reviews. Well, it was so nice meeting you, Dr. Cho, and thank you everyone who's watching. Have a great rest